Hi, everyone. I'm David, and it is just a tremendous honor today to have Anthony Salvo join us. Anthony and I go a bit of a ways back, I'd say, and first met Anthony, I guess, back in 2003 or so,
Yes.
when he was one of the key individuals at the New York Stock Exchange. And it's really great because Anthony has such a tremendous background in change management and just basically IT operations in general. And I think this is going to be a great conversation. So thank you for joining us today, Anthony.
You're quite welcome. Thank you for the invite.
Yeah, maybe you can give a little bit of background on yourself before we get going.
Yeah, hi. Hello, everybody. Welcome and thank you for attending today's webinar. Yeah, I've been around the block and back, probably 40 plus years now. Basically, I have an operational background, and my roots, really what made me today really was the continuous service improvement on my skill set at NYCHH and the New York Stock Exchange. So I started there. I actually left there in 2009, and it was great timing because Health and Hospital was just beginning their journey in service management. And I was fortunate enough to be hired at that time. So I've been at Health and Hospital for about 12 years now.
That's awesome. So what I'd like to do is just provide a little bit of background on Navvia before we get into the actual presentation. For those of you who know us, thank you for joining. For those of you who are new, just a little background. So we actually started our company back in 1999 as a service management consultancy. And that's actually how we met Anthony back in the days when we were doing consulting work. During that time, we built the Navvia Process Designer as a productivity tool to make it a lot easier for our consultants to process assessment, process design, building out documentation and deliverables. Fast forward a number of years, we realized we had a product on our hands. So what we did is we transitioned from a consulting company, and now we're focused 100% on delivering the Navvia Process Designer to the market. If you'd like to learn more about the Navvia Process Designer, you can go up to the g2.com website. That's a peer-to-peer software review site, and check out some of the badges we've earned, and as well as some of the great reviews from our clients. Anthony, why don't you just provide a little background on New York City Health and Hospitals for us?
Okay, New York City Health and Hospital, we're the municipal hospital system for New York City. We're the largest municipal hospital system in the United States. We have 11 facilities, places like Bellevue and Elmhurst, and large hospital centers. We have dozens of long-term care, outside clinics, public schools that are connected to our network. Our workforce totals about 65,000 people. About 40,000 people are on the H&H payroll. About 26,000 are either consultants or providers or clinicians. And when I say providers in healthcare, those are doctors that plug into our system and things like that. So that's how large New York City Health and Hospitals is.
And I imagine change management is very important in an environment like that.
Yeah, certainly. Where we fit in this organization is there's a division called EITS, Enterprise IT Services. We're about 1,700 staff members strong. These are all the technical IT people, okay? So I fit inside of that division, and we report in under our CIO, Kim Mendez. As far as my team, okay, I have a team of 8 people. They're technically oriented, operationally oriented. I have 5 change managers, okay? I have the change management group, and I also have the problem management group. I have 3 people on problem management. At least 2 of those people can go both ways, change management and problem management. So given our demand and our capacity, or if we're going live with things like that, we're able to adjust to handle the rate. My team, I have an excellent team. I'm nothing with my team. They have a wide variety of expertise. We have network engineering, operations engineering, software development. We have people with clinical expertise. Pretty much everybody on my team brings a certain part of what I grew up with to the table. They're all, before I hired them, they were all demonstrated, besides their resume and their credentials, which are important. I needed to understand that they can demonstrate that they have operational experience, and they're self-starters and self-doers, and they own things, and they're accountable to the team and themselves and the people why we're here, the people who they support.
That's fabulous. And I think this is going to turn into a great discussion. What I'd like to do, though, before we get actually into the meat of the discussion, I just want to frame today's presentation by starting with sort of a high-level definition of what enterprise change management is. And it's a process that's near and dear to my heart. It was actually when I started in IT, the first actual meeting I ever went to, like formal meeting, was an actual change management meeting. And I learned very early in my career how important change management is in respect to the mitigation of risk and the reduction of incidents and problems in an environment. So just to make sure we're all on the same page here. So change management is an information technology process designed to mitigate the risks of introducing changes into the environment. It has a number of key steps: registration and recording of changes, assessing changes, authorizing changes, planning and implementing changes, as well as the review and closing changes. With some evolution of the ITIL framework, change management sort of evolved into change enablement in terms of the name of the process, but I think most of us still understand and know it as the change management process. Now, in an organization like New York City Health and Hospitals, enterprise change management takes it to another level because there's so many moving parts in an organization. Whether it's infrastructure and facilities, it's the IT folks, it's what's happening on the clinical side. You need to see things from an enterprise perspective to make sure these changes are coordinated and that these overlapping changes don't impact each other. So just a little bit of background. And in terms to get some input from the audience, we have a little poll we'd like to just run, if you would help us out with that, please. And it's in regards to how you all see the maturity of your own change management environment. So this is, a multiple choice question. Do you see your change management process as being, unpredictable and ad hoc? Do you have a document process, but it's often circumvented? Do you have a well-defined process that's often very proactive? And do you have something that even goes beyond that, in which your process is measured, controlled, and continuously improved? So we'll just give folks a few moments to respond to that. Look, looks like we got about 60% of the people have responded. We'll just give it another 30 seconds, 15 seconds or so, just to let people respond. And interesting, so far it seems to be a pretty balanced response, relatively balanced. Okay. Yeah, we got about 70% of the respondents here. I think we can cut it off at this point. So what I'm seeing here is 17% of you are saying that your change management process is unpredictable and reactive, which, I would say, there's been a lot of studies in terms of the cause of incidents and failures within an organization, and change management is always, up at the top of a change is what often implements or it initiates a problem in an environment. So getting your change management process under control is one of the first and best steps to reducing the number of outages and issues in an organization. Look, about 50% of you have a documented process. Sometimes some of you have it circumvented. That's 31%, whereas 21% of you feel your process is well adhered to and often proactive. And a very good number, 31%, are saying that the change management process is measured, controlled, and continuously improved. Anyway, I just thought that would, just sort of give everyone some sense of who's on the audience here today. And by the way, feel free to ask questions as we go through this presentation. We'll have some time at the end, but also as we're going through, we'll be happy to take any questions that come in. So we can take that down. So I think, Anthony, you already touched upon this a little bit. The organization, enterprise change management organization, reporting, staffing. Is there something else you want to add to that structure? Maybe one thing I could ask you was there something that really, was there sort of a catalyst that really got this organization moving and in place? Maybe we can start there.
Yeah, certainly. You know, sometime in year 2009, you know, New York City Health and Hospitals, we have these major hospital centers all over the 5 boroughs of New York City. Everything was decentralized. These centers ran their own IT, had their own data centers, did the changes the way they needed to do them to support their particular facility. Mm-hmm. Sometime in 2009, it was decided for cost efficiencies and everything else, that some sort of effort had to be put together, some sort of evolution to this defragmented model to a more centralized model. So that's where the creation of the Service Management Office came. And really some of the initial things they wanted to target, of course, is we had 6 or 7 service desks throughout each of these facilities. So one of the first items were to actually put together a multi-year plan to consolidate all these service desks into an enterprise service desk. Along with that, data centers were being looked at to consolidate to 2 data centers, start moving stuff out of these facilities into our data centers under the control of EITS, which is referred to sometimes as central office. Okay, so along with that, they brought in some people. They brought in a person to head up the SMO, and they started actually building it out. And besides incident management and centralized service desks, the next thing on the list was our IT, our change management. How are we doing it now? Okay, so that was the emphasis. It was great timing for me because the exchange was going through some downsizing and all that. And I left there December 2009, and by February of 2010, I was an employee of New York City Health and Hospitals. And they brought me in to actually start standing up an enterprise change management process. I was the only person to begin with, and I had somebody that was wearing multiple hats help me. But I started working very closely with one of my peers who did all the work for the centralizing of the service desk, mm-hmm. And that's where we started. With this, moving that forward.
You know, it's interesting. You mentioned Service Management Office. We did a webinar a couple of months ago with Columbia University on the Service Management Office, and there is a recording up on our website of that. How important was the creation of a Service Management Office in terms of getting this change management infrastructure in place?
Oh, well, it was instrumental because we ended up we focused on these sort of things, what the baseline looked like. Everything was fragmented. Everybody did their things their own way. You know, there are IT people scattered everywhere, and they do their own flavor of change control, and such. But where technology was going, shared technology like shared storage and everything for cost effectiveness is shared these days. They knew that they had to start consolidating data centers, consolidating the service desk, and actually putting together processes that were, worked with stakeholders, put together these processes that were rolled out across the enterprise.
I think the key word there that you mentioned was focus, right? Things that you need focus to make sure that you're getting the results from things. And too many folks, I believe, they'll stand up a process once, but there's no governance, there's no continual improvement, there's no control of the process. So the service management office is a great focal point. Hey, we got a question already from David out in the audience. So I'll read this question to you and see if you, and since you have some experience with problem management as well. So for those folks that do both problem and change management, how do you handle the natural conflict that arises in the event that they're acting as a change manager when one of their problems actually raises a change to resolve the problem? So it sounds like that conflict, so as a problem, you're authorizing a change that ends up causing a problem. Have you seen any issues from that respect? Because it sounds like you had some expertise in problem management as well, Anthony.
Well, is the question that there was a schedule change and it caused a problem?
It's just more, I guess, in general, how do you handle the natural conflict that arises in the event between someone who's wearing those multiple hats?
Well, okay. All right. Well, we have, we do have separation of duties. The processes are totally different. If you have an issue that's either caused by a change or undocumented change or just issue arises, really it starts with incident management, right? The incident is recorded. Then we look at whether there's a workaround or a fix needed to be quickly applied and such. If we start a problem investigation, it's really to understand what actually went on. If a change caused it, it was planned and the change caused it, and stuff does happen, but we really start to dive into, was it planned properly? Were all stakeholders involved? Were all the touch points and dependencies planned for in that change that might have caused this problem? Besides our problem process of doing a root cause analysis, we really stepped out because we exist to support these hospitals, okay, and the critical care they provide. So as part of that, besides figuring out with the technology people what happened and how it's not going to happen in the future, we also have well-established inside the problem management process. We want to understand the impact from the IT side, but most importantly, we document the impact on a clinician side, on the facility side. If you were down for any length of time, IT may bring it up lickety-split quick, okay, but it has caused some interruption downstream. Reconciliation in a hospital environment has everything to do with if you go to downtime, you're registering people manually. You're not getting imaging. You're not getting blood. You're not getting these things. You're backfilling a lot of this. So within our problem management process, we document that impact. And then more importantly, we develop an action plan with people accountable for executing the action plan to make things better or avert what you might have got in trouble with to begin with.
It sounds to me too that one of the key things you said is the separation of duties, back to Dave's question. And I think, to me anyway, I mean, for what it's worth, incident and problem probably have a tighter relationship than problem and change. So you might want to look at restructuring from that perspective, who has ownership of the process, is to have that separation of duties. You started as a team of one. How did you and this is a question from Mark. You started as a team of one. How did you justify additional FTEs?
Yeah,
because you've grown quite a bit.
Yeah, well, to begin with, to be successful too, you need top-down ownership, top-down messaging. So at that time when they started the SMO, from the top down, from our CIO through the organization, that was the mission at hand. And we did a large socialization effort. I spent a few months out in the field to understand hospital operations, okay? Everywhere we went, whether it was for the enterprise service desk or to understand the IT at a local facility, we went there. And besides just giving them a presentation and then disappearing, okay, I have a nature of rolling up my sleeves and getting involved. So a lot of what we had to do with having these people in these different locations have confidence in me and whatever I was trying to do, that I wasn't just telling them how to do it. I was doing it with them and growing with them.
So you had to earn their
Yeah,
respect.
yeah, and it continues up until this day. And my entire team, before I hired them, they needed to demonstrate to me that they had a sensitivity for that, or they had a track record of doing that. But going back to what you said, it was all about tracking, logging, okay, the number of changes that happen, okay. The feedback that we got from facilities is we have IT in our places doing things and we don't know when they're doing them, okay. When things happen, we can't go anywhere to see who did what and when. So it was all about recording those changes and then exponentially showing over time the more changes that were logged. At some point, it was more than Anthony just paying attention to them. So I actually demonstrate the growth pattern throughout the months and years going through that, and that's how we approached it.
You know, you did mention back from when we were talking about problem management a moment ago about the business impact analysis. Like you looked at the root, what was affected. Did you do any costing of the cost of a failed change? Did you do anything along those lines to help justify the expense, saying, you know, if we could get this under better control, we'd have fewer outages, or we'd, you know, spend less money?
Certainly, everything this data that I collect, I make it into information that drives things like that, where the mean time to resolve, just, you know, instant things are always going to happen, right? But really, when you boil it down, it all comes down to whether you plan properly and you communicate it out to stakeholders, and whether you, when you do changes that have potential for impact, especially clinical services, that you have the right people available quickly. You know, the hardest thing to figure out is what happened, where it happened. Okay, once you do that, you fix it pretty quickly. So having that planning structure, that support structure in place, and to lessening the mean time resolve is the entire package of information that you want to give back as a sound rationale for the value here.
You know, that's a great answer, Anthony. And, you know, there's, I met back in the day when we were doing consulting, one of the things we were trying to do was help a customer justify a change management program. And this was with a large financial services organization. And what we actually did is we went in and we just interviewed a number of senior people and said, hey, what's the most impactful incident that you can recall over the last 6 months? You know, oh, well, we you know, this system was down, or we lost this application, or we couldn't deliver this service. And so they reported, and it, sure enough, you know, there was a pattern. Most people remembered 1 or 2 or 3 of the same major incident that had occurred. Then we went back to the disaster recovery folks, who often have information on business impact analysis, and we did a calculation and said, well, what did this cost you? Then we went and we looked through all the logs, and we figured out most of those changes. One of them was they allowed a vendor to go onto the floor and make a change to a storage subsystem in the middle of the day. Well, that should have been caught through change management. Every one of those things that caused the major impact was a result of a failed change, and most of those could have been mitigated with good change control practices. So that's one way you can help justify change control.
And you know, a key component of that, as we got into 2010, 2011, I guess by mid 2011, as my manager built the service management office, you know, incident, service desk, key component, change, key component, problem, change, important. What he did, he actually brought somebody very skilled with BCP, you know, business continuity planning, and DR. So as we built this service management office out, those were the core processes that we focused on and we worked on. And you can't underestimate that you need everybody to plug into programs like this. It's the IT staff, it's the management, that engaging them and working with them and getting to have them have confidence in you as a partner to move things forward is the socialization of that. Never forgetting that. There isn't a day that goes by that I don't recognize a team that we work with at some level. Some things are for improvement, some things for, identifying change champions, we call them. Some of the most rough culturally, they grew up in a different IT environment. People, when we started off with, are some of our best change champions these days, believe it or not.
Yeah. Well, it's interesting. We're talking about change management here in terms of an IT process, but organizational change management is just as important to make this work.
Yep.
A few more questions here. Two of them are actually related, one from Lori. Hi, Lori, and one from Jeff. So great question, Lori. Is a change manager a required approver on each of your change requests? And actually, I'll talk a little bit about Jeff's question because I think the two go hand in hand. So Jeff's saying we have some confusion on different types of changes, specifically between standard, pre-approved, and normal changes. Have you experienced this? If so, how have you navigated educating staff on the differences? So just from Lori's perspective, typically a standard change doesn't need to be approved by folks. But why don't you talk to how you do it in your organization?
Yeah, it's, we follow the foundational components of these processes are, the ITIL framework, and standard no impact changes are very well defined. They're things, they're routine day in and day out things that very, very little risk or exposure. You pretty much put a proposal in for that. We review it. They're pre-approved. They may be data updates and things like that. And they're approved when you're doing the assessment to create a standard change template, and they move along. And the most important thing is they're recorded. You make it easy for them to give them the template. 9 out of 13 fields are pre-populated. So there shouldn't be confusion about that unless they're not really getting the differentiation of change types based on a best practice model. A normal change is totally something different. A normal change is a normal change isn't the same thing in and out. It would be a standard change or a no impact change. A normal change is something that's planned, coordinated, identifying touch points, identify dependencies, identify your change window, comes into our queue, and we assess it. We assess it for the artifacts that are attached. I know every change that comes in, whether it's a normal, expedited, emergency, you have to have an artifact. There was a demand asking for this to be changed. There was an incident to resolve something. There was a defect in testing. So a normal change has those foundational artifacts associated with it, and it goes through an assessment, an approval process, and into a cab rotation. We have different cabs here, and we can talk about that in a bit, but that's the difference between, big difference, normal, standard, no impact stuff to normal changes. And it just may be, I know what we started with the SMO when we did this here is we had training for the entire enterprise organization. We had ITIL training, okay, for everybody. It was V3 then, but everybody in IT, we conducted training. We brought a trainer in for at least 2 or 3 years, all right, to have consistent training across the organization. So our terminology and our nomenclature was understood, and these change types were understood.
That's great. Thank you for that. There are some other questions. I'm just going to hold off, and we're going to move forward a little bit. But hold tight for those of you who have submitted a question. We'll definitely try and get to these questions live on air. So the next thing I wanted to ask you about, I guess we really touched upon this a little bit. We went a little in terms of what prompted the enterprise change management program. It was basically having such fragmentation in IT. The implementation of an SMO was the single focus, top-down sponsorship that helped you get the resources and the FTEs you needed to grow this team. And so that's good. One of the things, that's important these days in any process is what kind of tools you use to automate the process. Can you talk a little bit about the technology?
Yeah, sure. When I first started in 2010, it was developing our processes. We use the ITIL best practice framework, and I had some clue from my previous job on how to gather people together and hear from stakeholders and develop a process. Microsoft Word was our tool, SharePoint was our repository. So defining those processes, working with stakeholders to come up with roles and responsibilities was everything to do with that. As we grow through that over the last 5 or 6 years, though, we moved from, although we still use SharePoint we have a website, we have a SharePoint site for all our information, our guides, our tooling, our training, everything we do with change and process and all that business. Okay. We've actually purchased an enterprise license for Navvia. Okay. Like David said, I grew up learning about service management from the people who started the consulting portal in Navvia. So I had a good process background with regards to that. And it was a very heavy lift when it came to manual things to do. Navvia automated a lot of stuff for that. So Navvia now is our process repository. We create processes there. We may export it to a SharePoint or have a link to a SharePoint, but we use Navvia as our training hub, our process creation. It plugs into nicely with other capabilities for process assessment and governance. So our tooling with our process development and maintenance is on top of Navvia. We moved, when I first started here, we had Remedy. I was very accustomed to Remedy. We moved in 4 years ago this June. We transitioned to ServiceNow, which was just stepped up the technology, like 30 years newer than what we were running under the covers for Remedy. And we haven't looked back. We use the ServiceNow platform, incident problem change, SLM, things like that. We take big advantage of the capabilities in ServiceNow with their CAB workbench. We used to have a spreadsheet and put that together and have a CAB workbench is all integrated with our change module. So we take advantage of that. And as far as tools and infrastructure, just a breakdown, because enterprise change management has everything to do with infrastructure stuff, IT stuff, and also clinical build. We use an EHR product here called Epic. And we did a whole transition off of a legacy product called QuadraMed, QMed. We're on Epic with all our facilities as of a couple of years now. It took us 4 or 5 years to get there with that. But with our clinical cabs, we have 3 clinical cabs a week, Monday, Tuesday, and Wednesday. We have that with that frequency because you can imagine, a few hundred changes a week with clinical build. With regards to that, we have 1 infrastructure cab on Friday mornings. We have pre-cab reports, what's pending approval reports. We have cab attendance, okay? And we have post-cab reports. So we have a lot of structure around the things that you need to support the governing bodies of a process for people plugging in and doing the right things. All that data we produce information into and such. What's important for us, how do you tie IT infrastructure to clinical operations? Well, anything you're changing in our infrastructure or has to do with IT that has a clinical touch point, an H2O Epic touch point, we have a flag on a change for that. Besides bringing it to an IT cab, the Friday cab, they're required to bring it to announce it on a clinical cab because it has clinical potential for clinical impact. So we have a very tightly run clinical change, which is a little different than our IT change, but we had good opportunity from the beginning when we moved to this fragmented QuadraMed. Each facility pretty much had their own database to a centralized Epic environment. We had clinical leadership back us 102% on how to do change management. It's very structured and it's very tightly integrated with the infrastructure side of the fence, where one hand knows what the other hand is doing. So that's some of our enterprise change management tools and infrastructure.
Did you say release management is also a module of ServiceNow that you're using?
Yes, we're using release management. Mostly we use release management in our clinical change control. Every Monday, Tuesday, and Wednesday, every cab, oh, excuse me, we have a release associated with that day's clinical cab. We have 2 or 3 or 4 dozen changes for that particular day. They're all attached to that release bundle. And then the clinical change window opens up later in that day.
Mhm.
For that, we're moving to a more monthly clinical release that we just actually started that. So besides the business as usual pace we have to keep with 3 cabs during the week for clinical operations, we're targeting demands that come in that have enterprise workflow impact. You're changing things that are going to affect the enterprise, not a particular facility, right? And we're starting to bundle that into a monthly release. We don't use release. We use release for clinical types of things. We haven't really entered the arena yet for releases for infrastructure types of things, bundling things together. Those are different challenges that we still need to get better accustomed to and to move us in that direction. But the infrastructure things are tightly controlled with pre-planning, stakeholder meetings, and coming up to an infrastructure cab on Friday mornings.
That's great. So that question about release management came from Sherry. So thank you for that question, Sherry. So Christy has a couple of questions. I think you already touched upon one of them. She was asking if you're using Epic for your EMR.
Yes.
And would you be able to speak about how the workflow of that and how you get that in?
Well, we have some, and maybe we're actually going to be moving forward both in a ServiceNow users group and also Epic users group. We're actually going to showcase some of those workflows, but clinical workflows really have their own life of their own. All right. You have this massive Epic application that has 3 dozen modules in it, everything from ER stuff to the radiology, surgery, and op time, and all those modules live in Epic. But then you have ancillary systems that plug into Epic. Like we use Cerner Millennium Lab as a lab system. Okay, and we actually partner with Northwell in a joint lab operation we have in Long Island City. So we have ancillary systems that plug into Epic, like lab, like dietary things, like radiology. Blood services are external. Some of them are cloud-based, some of them are premises. So the point I'm making is there are many ancillary downstream systems that are big applications in ourselves plugging into Epic, which pretty much drives the type of workflows we have in change. We have at least several clinical sub workflows. You may choose an Epic normal change, but we have a sub workflow that actually defines the touch points for lab, and the touch points for Cerner and Northwell, what they got to plug into it, and so on. So we have different subtypes for the types of things we're doing in our clinical build and the way we support clinical systems. We actually have when an piece of infrastructure is being changed and it's a piece of infrastructure that has to do with Epic directly, okay, we have a workflow for that. We have a flag for that. So certainly we can schedule sidebars with whoever. I'm always anxious to talk to healthcare customers out there that use Epic and ServiceNow or other, because we have a lot of the same challenges there, but we have detailed subtypes that drive clinical change management.
Well, thank you for making that offer, if you will. So if anyone out there does want to get hold of, I'm sure we can help facilitate getting you all in touch with Anthony if you have some questions. I'll take one more right now and then we'll move forward. So Christy also asked, how do you deal with changes from external providers. So do you have any hosted service providers that impact your clinical staff but are not managed internally?
Yeah, great question. And this is how we do it. Inside ITS, that support IT of support body, we have over 2,000 different applications. Okay. We have a concept for it's sort of in the financial world, it might be labeled as customer service, but we have IT app owners defined for every application. Okay. Whether it's infrastructure things, okay, or whether it's clinical things. I'll give you a good example. We have a service line that under the CIO that drives all clinical stuff. Under there are managers, there are teams that handle Epic or external vendors and things like that. The IT app owner for something like lab, okay, or blood would be defined as an H&H person, workforce person.
Mm-hmm.
Their responsibility is to manage that vendor relationship. So
Right.
in the case of Northwell helps us with a lot of lab support. Cerner is the third-party system we use. So inside the IT owner for lab has the responsibility to coordinate with Northwell Cerner. Okay, in this case, because lab is so complicated, we actually have Northwell people configured in our Active Directory and our ServiceNow uses. So the net is when things are happening outside H&H that plug into our systems, the IT app owner is responsible to be the change coordinator. They create that change. They understand what the ancillary system is doing, when they're doing it. Mm-hmm. If we need to schedule a stakeholders meeting. So we have an inside body representing that change on a clinical cab or an infrastructure cab that their support job is to know how that ancillary system works with us and the details of it.
That's awesome. Moving forward with our next question. Are there any challenges that you're currently facing? And I'm sure there's at least one or two, but are there any challenges you're currently facing in regards to change management?
When I started to begin with, of course, you have this fragmented operating model, and it was good for the many years. They had to stand up IT into healthcare to begin with and everything else. But of course, there's, this whole centralization challenge, this whole confidence building challenge, this whole cultural attitude, legacy baggage that came with it. And that pretty much, after several years, that has dissipated because we have this thing up and running and it's running well and everybody partakes and it's a good thing. We constantly have challenges with, certainly, I know right now we have 2 established data centers and we're transitioning to 2 new ones. We're coming off one vendor, we're moving to another. And so on. So besides data centers that on H&H premise, we have outside vendors we're going to. So there's a lot of challenges with that, moving all this infrastructure and everything else out of one data center into another data center. Mm-hmm. There's always room for improvement. There's always areas. I know just over the last couple of years, we had multiple intakes coming in. And just before, few months before COVID hit, our PMO office started to use the demand module in ServiceNow. Mm-hmm. And out of the gate, it helped us so much because every clinical request comes through demand management. And it's at a maturity rate for 2 years now. But so now over the last few months, our PMO is working with us and working with everybody else to have all other inputs come in through this centralized demand. So there are challenges there. We're standing up infrastructure services to come into it. We have a whole business-oriented division that is coming into demand management. So there's no shortages of areas that still need to be streamlined for efficiencies or brought into having standard processes. And those are our challenges. Yeah. That's the reason why we're here, to identify those challenges, understand them, and partner with stakeholders to actually make things more efficient and more cost effective.
You know, over the years, especially back when we were a consulting organization, we did a number of assessments and process projects with various healthcare organizations. One of the things I noticed is that healthcare and higher education, it would be the other group, tend to be very decentralized, and
Yes.
each area really wants control of. Is that one of the challenges that you faced?
Uh, yeah, certainly, without a doubt. But what helped us a great deal, the creation of the SMO 10
Yeah,
years ago helped really to establish the baseline for a centralized, cost-effective approach for IT. Okay. Certainly when we transitioned from QuadraMed, QMed into Epic, it gave us great opportunity to, and it was all about the leadership they brought in to
yeah,
do. They were, of course, new leadership comes in, everybody wants to meet with them. So I had my little road show, what we were doing with IT, what we thought our vision was for a centralized EHR. And the people they brought in got that and understood it. So it was a 200% from the top down, something, what do you need? And actually, when we started to bring on Epic is when I had more opportunity to actually beef up my change team. I think before Epic, we had 2 people, and a problem manager. But Epic, I demonstrated that the change rate would be such, and we got them from day one, and it proved it out that I was able to bring in that Epic technical expertise.
right.
I have a couple of people on the staff that, besides having technical expertise, one in particular has clinical expertise, nursing operations, hospital operations, and such. So as we stood up that new EHR, I brought in those people that had expertise, not only clinically, but also IT-wise, and demonstrated operations abilities like that. So that lessen our challenges, because when you're working with these teams and they see that you have somebody who's did nursing operations or
Right.
network engineering.
There's confidence. I mean,
Or third shift operations over the graveyard shift. They understand everything the challenges for these stakeholders, and we partner with them.
yeah, it's a great way to build confidence. Just a shout out here to the audience, Christopher, Curtis, Ravi, Harry Haran. I see your questions. We'll probably leave those more towards the end and we'll just wrap up a few more slides, but we see your questions and we will get to your questions. So the next question I actually have for you, if you had to summarize some of the key benefits of your enterprise change management approach, what would those be, Anthony?
Okay, well, we certainly have established process. We have a world-class tool. We got a great development team that keeps that up to date. Infrastructure keeps everything humming. Okay, so we have, as far as change management, we have a set cadence. We have cabs. We have information going out before and after cabs. We have change windows. We have, with planning and coordinating and stakeholder meetings, they're not just one-offs. They're part of running day-to-day operations here. So increased planning, stakeholders involvement, consistent user communications out, what's coming their way and when it's coming their way. And of course, my team provides, we have statistics, we have metrics, we make information out of that to tell a story that shows us exponentially how we're growing and where we need help and what we got to be working on. So, I mean, that right there, those are the benefits of having a program like this, and me fortunate enough to have a team like that. And more importantly, having the wider team. I see myself as reporting into everybody and I'm matrix to everybody. I may not report into the business or data analytics senior vice president, but I have myself as a dotted line everywhere, and my team does too. So that's the benefits. We have that sort of open door relationship with everybody.
That's amazing. And the last question, really, any lessons learned? And then we'll get on to the questions from the
Yeah,
audience.
yeah,
Haven't
yeah.
forgotten.
Real quick, it's all about, to begin with, it's all about top-down support. Having executive management, middle management ranks to have skin in the game, and to have all our messaging the same, to have some framework, to have something to level set your terminology and nomenclature. ITIL was that. We have world-class tools. We use Navvia. It's probably the most cost-effective thing we pay for here. Okay, we have ServiceNow, which is a world-class tool. Top-down support. I've said everything before, but partnering, mentoring, involvement, transparency is critical, and clear, concise, communications out. And those are the lessons learned. We didn't start out of the gate with that, and we have a lot to improve on. And we're just starting a new round of process assessments. Okay, but those are the lessons learned. Chipping away at that. Do not try to boil the ocean. I'm here 12 years, and there's still a lot to do. So those were the lessons learned there. And I try to. I believe I have some peers on this call from my previous life. I'm a passionate person about this. I take things seriously, especially with patient care. But you have to have some level of fun with this stuff. All right. Mm-hmm. It stopped being fun for me. It's when I get on my horse and I mosey out.
Great. Well, that's wonderful. So I think what we'll do here is we have about eight more questions from the audience. We'll do our best to get through all of these. So Christopher was asking, and I assume this is from Christopher's perspective, being someone wearing different hats, change, incident, problem, config. I was wondering if having all your processes in place, does this speed up procedures and requests and other changes that would have to be made or done? So I just, if I understand the question correctly, I think he's asking, is it important to have all your processes defined and in place to speed up procedures and requests?
Yeah, that's an approach you have to figure out. Like you always hear, don't boil the ocean. We started with centralizing our service desk and change. We didn't start with a centralized intake. Certainly the interoperation between processes, it makes things easier. Like here, I'll go back to that change, the artifacts. When we see a normal change come in, it better have an incident. Well, we link it from our incident module or a demand or a defect. So having those processes stood up and well understood with some level of maturity certainly adds efficiencies. I mean, that's why you're doing this, to add efficiencies and exposure and transparency. I can go to a change and I can see what originally originated from XYZ for Bellevue, and they needed a workflow, and it came into demand and was reviewed by the PMO, and the security review was done. I mean, when you enter change control, I'm looking at that record and all my ducks are in order. So there's some efficiencies there to be realized and be enjoyed.
I liked your comment on not boiling the ocean. I mean, if you take a look at what's really, incident, problem, change, service request, configuration management, these are the ones that are at the heart of pretty much any infrastructure organization. You really need to do those well. And it's almost like Maslow's hierarchy of needs. If you're not doing the basic stuff, you're never going to be able to do the more sophisticated, complex stuff. So get your basic processes in place. Curtis was asking, how are you tracking cab attendance? Is it within the cab workbench?
Yeah, the way we do that is for our clinical cabs. Okay, for our clinical cabs, we have a roll call. We spend a few minutes a day. We look at cab workbench, and we have a WebEx going too. But we actually, each of those Epic teams, we go down a list real quick. Okay, and if we see people in here, we ask for a shout out with that. But with our clinical cabs, we can tell you from day one who attended, and each day in each cab they're attended. Infrastructure cabs, we have a WebEx. Okay, we pretty much know we review the changes on the cab. We know who has to be there. Our infrastructure cabs went from maybe 10 or 12 people showing up on Fridays when we first started. Over the years, I mean, we have 40, 50, 60 people attending our infrastructure cabs on a Friday morning. It's a set cadence. It's if a cab agenda comes up, the cab coordinator has to be there, or they can't have a warm body going through the change if they don't know the change. So that's how we actually track those types of things. And they find that, the cab is the last tactical place that you see if there's a conflict or something changed overnight and you have to revert. So people plug into it. It's pretty efficient. It's an hour. It's very organized, and things only come to cab if they went through the tooling and service now and they're in the right state.
That's great. What I'm going to do is just move on with a couple of wrap-up slides. Anthony, would you have a few more moments to stick around if there's some questions? Okay, so I'll just do some wrap-up slides now, and then we'll come back and finish up some of the questions that are on the list. So, so first of all, I want to thank everyone for attending this presentation. Anthony, it was a great conversation, and as always impressed when we have a conversation with you. So thank you so much for being part of this today. Just to wrap up a couple of things, I do want to mention the Navvia Process Designer. The Navvia Process Designer is the tool that we built to help with process design, implementation, assessment. We built it as consultants, and it really has a lot of it sort of makes you your own consultant, if you will. It has features that covers process design and sharing, user story and requirement gathering, including an integration with ServiceNow, assessment and governance of your processes, lots and lots of templates, including change management, change enablement, release management, and pretty much all the ITIL processes. And we believe it's a tremendous value. So if you'd like to check that out in more detail, just go up to navvia.com. There's lots of information. We'd also be happy to set up a live demonstration for you and your team. There's also some other great resources up on our website. We have a lot of blog posts around change management. Just go to navvia.com/resources and you'll see a bunch of blog posts. Plus, there'll be a recording of this presentation up there within the next couple of days. Plus, you can see some of the previous webinars that we've done. And again, if you want to set up a demo, just go to, you could actually respond to the email we'll be sending out later with this recording, or just go to navvia.com/contact and we can set up a demonstration. So let's get back and just wrap up some of the final questions here. And I think you might have touched upon this. So you are tracking attendance to the cab, right? With the cab. Yeah. What are your best practices around expedited changes?
Well, expedited changes, an expedited change is outside our normal scheduled release window. They still come in to our assessment queue. We still assess it, and it still contains all the artifacts. It's only that it falls out of a release window, but pretty much we handle it the same way. Of course, with ServiceNow, we have all these neat dashboards, and my entire staff, we have a queue watching rotation and such. So when expedited change comes in, it gets looked at quickly.
How do you manage DevOps changes managed by Jenkins? I'm not familiar with Jenkins, but how do you manage DevOps changes that might be controlled by the developers? We don't. We have one area, our data and analytics division has a strict DevOps discipline they follow. Okay, they really a lot of the DevOps agile things they do. They have test platforms and things like that, and really it's an arrangement with them. We actually started working with them about a year or so ago because that division was broken out and separated to stand up what they do. And
we understand the types of work they're doing. They certainly
Mhm.
plug into our enterprise change management. Okay, but we give them a lot of latitude, because the things they actually focus on, and this is the one division that does that. Data analytics is really they create widgets and reports and dashboards types of things. So if their infrastructure changes and things like that, they certainly plug into our change management.
Mhm.
Types of things where they have rolling, they may have a proof of concept or something like that. We're a little looser, because within their agile framework, they are documenting the input, the tweaking, the changes,
Right.
the 24-hour pilot of a piece of COVID data that needs to be represented a certain way and such. So there's a working relationship with them that fits their DevOps into to align what we're doing in an enterprise change.
Yeah. And just as a reminder for everyone, I saw one question. I think Catherine answered it directly to the individual, but this has all been recorded and you'll be able to see all of this on the website, and you'll get a link, an email from us later on today with, or tomorrow, with all of the, with everything you need to see this again or share it with your friends. We talked a little bit earlier about, external providers having an application owner, and for example, if there's an external SaaS system. Do you have any examples of areas where you do not have an app? So the question specifically is, do you coordinate the changes implemented by SaaS providers where there are no where the app owners have no control?
Yeah, certainly. I'll give you a couple examples. Well, here, take our big ISP providers or big trunk data providers. They actually, whenever we sign a contract or we use a service or something, there's some relationship, like our enterprise operations center, network engineering. They have a relationship with these big trunk providers and such. And a lot of these people, along with Navvia, okay, we're on a mailing list. When you guys are scheduling to change things, okay, you let us know. So if they get an email from a big trunk provider or an ISP that something is happening, okay, that email, at least enterprise operations center, we work very close with them. They work very close with the ESD. Somehow we'll get the messaging in, and if we need to communicate wide inside, we do that. Right. With regards to that. Any sort of SaaS environment we have, it's tightly coordinated. We have IT owners for everything. There's some sort of customer service or technical liaison that knows about the service or what we're using from this cloud service or anybody else we deal with.
Great. I was going to say there's two more questions, but a third came in, and we do have to be respectful of Anthony's time. So if we can't get to all of the questions, maybe we can get back with an email to you folks. Who are the members of your CAB?
Members of the CAB? Okay, it's really a tactical CAB. So here, clinical CAB. If we have 45 clinical changes on the docket for Wednesday's CAB, all right, we have each of those change coordinators. The person that created that change, or a team member who's not just a warm body that needs to represent that change, they are on that CAB. Usually when it comes to clinical things, a lot of those modules touch one another. They use shared files and resources. If they change something in an OR module or emergency room module, okay, it may have workflow issues, like here, when you're coming into the ER and you need to put somebody on a OR table, and you need CAT scans. There are workflows between these modules. So besides those clinical changes being planned with touch points, that clinical change for the ER, right, will have an approver from the OR module or the radiology module. So those are the people coordinating these changes are on that CAB. Infrastructure works the same way. The change coordinator is at that CAB, and if there's other technology touch points or whatever, or downstream implication. Those are the types of people that are at those cabs.
And last two questions, and we're going to cut it there. Last two questions, and I think you already touched upon this one, Anthony. How many different cabs do you manage, and how are they differentiated? So
Yeah, we have 3 clinical cabs: Monday, Tuesday, Wednesday. Anything to do with Epic or clinical applications come to that cab, and then we have a Friday morning 9 to 10:15. We have an infrastructure cab. And we might have an announcement from a clinical change in that infrastructure cab, or at a clinical cab, we may have a shout out announcement of an infrastructure change that may have potential to impact clinical operations, or a downtime is needed.
Awesome. And the very last question, and this is from Christy, to the SaaS question, do you log a change internally if there is no service impact? I'm finding resistance to do this work in ServiceNow unless there's an impact experienced by the business. So do you log a change internally, even if
we do not. There's a lot of network communications, large trunk service provider changes that, because of our redundancy and everything else, we'll just get a notice in and we'll know what's happening. So if something does happen, we know what was happening. We do not create a change unless there is impact. If there's impact, then yeah, then say the Enterprise Operations Center may create a change for a particular vendor that has an impacted downtime, for one of our data center routes or something like that.
Great. Wow, we got to the end of the questions, Anthony.
I have a request to shout out. Sure. Everybody on the call, if you're an Epic ServiceNow customer, I'd like to hear from you. We're looking at interoperability between Epic and our ServiceNow platform to move ahead. We speak with a lot of healthcare providers that are doing interoperability between what they're doing on Epic with regards to change, build, control, and interfacing with ServiceNow, change management, creating a process. So if any are out there and have experience in that area, you can give a shout out to me. I certainly would appreciate establishing a new relationship to talk about.
I'll tell you what, Anthony, as well. I mean, a lot of people registered who weren't able to make it today. I'll take that if you want, I'll take that request and send it out to everyone who registered and see if we can get some connections for you.
Yeah, without a doubt. Thank you.
All right. Well, once again, thank you all so much for being part of today's discussion. It will be up on our website in a few days, so feel free to go and have a repeat performance. Anthony, once again, a pleasure and an honor to talk with you. And
too,
Catherine,
David.
thanks. Thank you.
Thank you and Catherine for putting this together, and everybody who attended.
All right. Well, thank you, everyone, and have a wonderful remainder of your day. Take care, everyone.
Thank you. Bye-bye.
Bye.